Hello and welcome to Vet's Eye View. My name is Victoria Knight and we have so much to cover today. We're going to meet Tia, the Labrador mix, and Charlie, the cat. So let's head inside and see what Dr. David Visser has in store for us.
I understand things have been pretty good. Seamless at home, no health issues that you've noticed?
Other than all around her chest, her legs are bumps,
No,
but they
but-
don't,
None of that.
so far they don't, other than once in a while, like she came up with the limp thing.
Right.
But I don't know, maybe one of them bump pinches a nerve once in a while, or she just, but other than that, she hasn't had any more big limp issues. So,
Good.
Walks or something too much,
Yeah,
you know.
There you go, Luce.
she's slowing down, she's not as, we go for our walks and she doesn't go the distance she used to. So.
Yeah. Take a look at her whole examination. Has a little bit of tartar buildup on her teeth there. Not our primary issue today, but certainly want to have that on the radar for things to address. Looking very clear inside the ears. Check your shoulder lymph nodes and the front legs. I didn't feel any swelling at any of the major joints here. And now I'll feel these bumps that you were talking about. Well, I'm glad to say that in the armpits area where something could interfere with the nerves, it does not appear as if any of them are there even, let alone that they would likely be interfering. I'll also tell you that these fatty growths, which is what I presume these to be, tend to be benign. While they may be multiple on the body, they're not really spreading. They're just occurring in multiple parts of the body. Lipoma is the name of those. And they look like fat under the microscope. So if we did do a needle test to figure out what they are, if that's what it turns out to be, there is no concern about having to have them removed or addressed unless they're in a problematic area, like you're talking about with nerves or limping, or they're growing. If they grew down in an area where there's not much skin to stretch out of the way, that would be a problem too. These are in safe locations and could be a safe growth, so we could be at the safe end of the spectrum.
Well, and I noticed too, as she loses weight, it goes down.
Right.
It'll go up and down depending if she loses weight or gains weight.
Good point. It is the biggest content of it is fat, and
Yeah.
so fat all over the body, including in the growth, is reduced when dogs go through weight loss. It doesn't make the growth itself disappear, but it does make the size of the growth, like the size of the body, shrink down.
So we just had Tia in, and what was it that she was in for today?
So last time she was in, she had some issues that the owner didn't know exactly why she was squatting and dragging her rear, and it turned out that she had anal gland infections. Now, anal glands is something that people are not necessarily familiar with. They have these two skunk glands. That's the closest I can draw as a parallel. And sometimes those glands are just perfectly fine. They make fluid, and but other times they can get infected, and that's what happened. And so last time there was medication administered. This time we're checking to see if it was completely taken care of, but there was still some evidence of bloody discharge present. And so we wanted to give a medicine actually into the gland so it topically treats this issue.
Gotcha. So you mentioned the squatting and dragging. Is there other signs that you can tell that they might have that issue going on?
The most common thing that people will notice at home, they're not going to know that this is necessarily gland problems. They're going to notice itching or licking or dragging the rear on the floor, scooting as they call it. If that happens, we need to tune into the different things that actually can cause some of that. And gland filling or overfilling can be very itchy, and that's probably what tunes people in at home. They may not necessarily notice that there's blood on the backside, but it'll confuse them. Is this coming from the bowel? Is this coming from the glands? But we know the difference here by doing a special exam.
If a pet owner is witnessing that this issue is going on, if they don't treat it right away, is there any long-term issues that could come about?
Yeah, I think first of all, bother to the pet is the biggest issue, but then it can also form abscesses. If that gland becomes infected or blocked, it's going to find its quickest way out. It's not through its normal opening, it's going to be out through the skin. That abscess then is very painful, but nature's trying to do what it's supposed to do by draining that area, but that's too far given that there's medicine and medical approaches that can prevent it from getting to that point.
Alright, so she's here from her first kitten visit. Owner has had her for about 2.5 months now, and we are already running the feline leukemia test, and if that comes out clear, we're going to be doing her feline distemper vaccine and rabies We'll do a deworming today, go home with heartworm prevention that also does fleas. The only concern is that she's been having some little crusties on her left eye. That's been going on since she's had her. And she's been sneezing a lot too, little crusties on her nose as well. The other cat had the same issue. She's here for the same thing, but she's here for a recheck on the sneezing. And this kitty, that's the only thing, eating and drinking, no vomiting, sneezing, coughing, or she's sneezing. And she's indoor cat, and that's it.
Sounds good. Do you know whether the symptoms in the other cat started after this one's adoption? It did? Okay, so
Yep.
this one perhaps brought something into the household
Yep.
as a contagious thing, might have given something over. All right, we'll do a complete exam and see how things are.
All right.
There's quite a bit of inflammation in both of the eyes. The redness that we see here on the whites of the eyes and the puffy nature of the eye white or conjunctiva tissue is pretty remarkable there. I've seen plenty worse, but it certainly shows a lot of inflammation. That's the third eyelid that is coming up there. If you push the eye back gently, you can have the third eyelid come up. That's not a painful thing, but it's a way in which we can examine it. But you can see that there's a lot of discharge here on this eye, and so this one is producing more inflammation, or more discharge. But the other eye actually seems to have more redness on the whites of the eye up here at the top. So both eyes are affected. And not to be ignored is this amount of black discharge here at the nostrils. That's not normal to be there. We can't really see inside the nostrils very easily, but we know that the sinuses lie right under this area. And while I don't expect that the sinuses are going to have soft spots, I always feel for that just to make sure that there isn't any issue coming through. And because the next door neighbor of the sinuses are the teeth, I also want to look along the gums to see if there's any dental issues going on. And then of course to open the mouth to see what the throat looks like. The tongue, it kind of gets in the way, and I can pull the tongue down a little bit for a willing cat and just see if the throat looks red in any sort of way. So I have the information I need from the front of the respiratory tract. Now I'm just going to continue with the examination to see if there's any other contributing or separate issues going on. Ears looks pretty clean. Lymph nodes are sort of the regional police precinct for the area, and I would expect these two lymph nodes under the corners of the jaw to be inflamed or enlarged because of the regional inflammation. They're not too badly inflamed or enlarged, so I'm glad. Windpipe here feels normal. While I'm here, I'll check the shoulder lymph nodes, and then we'll go down the front legs to see if there's anything separate going on. Some cats that do a lot of wiping of their face will have a lot of discharge on the inside of their paws. People might think that there's a separate foot issue going on when really they're just bringing their paw up to wipe either the nose or the face. This kitty does not have any discharge on that toes area. I'm not detecting any enlargements or sensitive areas. Coat looks overall really good. Check the back side, confirm that it's a girl. I don't often get the opportunity to say, congratulations, it's a girl. But cats are sometimes hard to identify whether they're a boy or girl for some people, and I have had that opportunity to say, congratulations, it's a boy. Okay, things are looking good there. One final test, that's the temperature. So normal temperature for cats and dogs is 101 to 102.5. And if we get a number that's in that range, I'll be satisfied. Temperature is 101.5. Good news. So this is Tia, and Tia has a history of the anal gland abscess, and what we're going to be doing, it's much more comfortable this way. We don't have to sedate every dog, but if you're going to do something that's uncomfortable, you want to make sure it's comfortable for them to receive that kind of treatment. So when using a gloved hand or finger to be able to examine the glands. That's how we found that there was infected material that was in the glands. Normal material is hard to describe, but normal looks normal. And when there's bloody kind of discharge, we believe that there's infection associated with this. The glands are located at 4 o'clock and 8 o'clock of the anus itself. And they are just like skunk glands, and while skunks have control over how they spray the gland material, dogs generally don't have much purpose for them. The fluid could mark territory, so if they have a bowel movement, a little of that unique fluid gets on the stool, and that can mark their territory. But other than that, no domestic purpose in these glands at all, and they can then be a problem. I'm going to go in with a gloved hand to put pressure on each of these glands and get all the fluid that's out of there to make certain that, and it's much easier when she is comfortable like this. And then we'll be putting a medicine into each gland to treat topically. That'll be much more effective at getting the medicine to where it belongs. So I'm at the 8 o'clock position. And if I rotate this out just a little bit, you can see a little bit of an opening right there. It's black, it's right at the tip, and that is the opening. Now, we were effective at emptying most of the fluid out. I just got a little bit more of it there. This one we were not as effective on this side, but if you look from this side, you can see that there's bloody type material that is coming out of that gland. So what else I'll have you do though is that if you can hold the tail upward like this. So this is one opening of the anal gland right over here, and just on the opposite side, this gland over here. So I'm going to fill this one first with just a little bit of this material, and then I'm going to go into this gland and fill it as well. Get some new ointment on here, and then feel, not to put pressure on the glands, but to feel that it feels as though there's material in there. So now there's material in there. The ointment is going to stay topically. It's not my goal to get it out of there, but I just want to confirm that I have had enough material actually put in there. So, all set. This medicine then has a more direct effect by getting to the site of the problem rather than using a pill, going internally, hoping that some of the medicine gets to this gland area, so it'll be much more effective. I think we took a medication approach last time, but by actually topically getting this ointment on there may have required going through extra steps, but I think ultimately will be more effective. Plus, she needed a nail trim, and that's the only way she welcomed it.
Thank you for tuning in to today's episode. Be sure to subscribe to our YouTube channel, like our Facebook page, and if you have any questions, do leave them in the comments below, and we would be happy to answer them. So hold on to your leashes, and we'll see you next time.